Antibiotics are utilized in order to kill pathogenic bacteria. However, it is also acting as a selective agent for their survival. Antimicrobial resistance, or AMR, occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. Bacteria that are resistant to a large number of antibiotics have been dubbed superbugs. If few members of a population survive, they can replicate and give rise to a newly resistant species by passing on their resistant genes. Resistance can arise from random mutation or horizontal gene transfer via conjugation or transduction. Drug resistance is often carried and transferred via plasmids or transposons. Furthermore, some species are capable of transferring plasmids to other species. Plasmids are capable of containing genes for resistance of several antibiotics, including those called resistance R factors. Additionally, due to the rapid reproductive rate of bacteria, a new selective resistant population can arise quickly. There are four primary mechanisms of resistance in bacteria. One is blocking the entry of the drug, which is primarily seen in gram-negative bacteria. Their cell wall restricts absorption of many molecules via their special openings called porins. Another mechanism is inactivation or enzymatic destruction of the drug, where bacteria can mutate to produce a destructive enzyme. Bacteria can also alter the drug's target molecule or site, now allowing it to bind and perform its function to destroy the cell. Finally, they can also develop protein pumps which can expel the antibiotic. My superbug of interest is methicillin-resistant Staphylococcus aureus, also referred to as MRSA. MRSA alters the drug's target molecule, and beta-lactam antibiotics, in this case methicillin, typically target a penicillin binding protein, or PBP, on the cell's membrane. However, if PBP is a different shape, then methicillin no longer works on it, which is how MRSA gained resistance. The bacteria Staphylococcus aureus are part of our skin flora and also a common cause of infections both in the community and in healthcare facilities. And people with methicillin-resistant Staphylococcus aureus infections are 64% more likely to die than people with drug-sensitive infections. And approximately 30% of humans are asymptomatic nasal carriers. MRSA is a part of our normal flora. And there have been reported 4 waves of antibiotic resistance in Staphylococcus aureus since 1940, when penicillin was first introduced in a clinical setting. Genes for antibiotic resistance occur spontaneously, and misuse of antibiotics can give rise to these new strains. Overprescribing antibiotics or not finishing the required dose can encourage the survival of resistant strains. Additionally, utilizing antibiotics for viral diseases such as the common cold, or not properly sanitizing an environment, and especially including antibiotics in animal feed to promote growth or utilize subtherapeutically. It is estimated that 80% of antibiotics used annually in the U.S. are given to livestock. With more opportunity to be exposed to the same drugs, eventually a resistant strain will arise and new antibiotics are hard to develop. A human can be infected by a resistant pathogen of agricultural origin through contact with livestock or through ingestion of bacteria from contaminated meat or water. Therefore, livestock can then become potential reservoirs of zoonotic infections. The World Health Organization launched the Global Antimicrobial Resistance and Use Surveillance System in 2015 in order to monitor resistance in the food chain and the environment. Although it's an uphill battle, we can help by washing our hands, taking medications as prescribed, and educating our local farmers.